Before the treatment, I couldn't hold a glass of water because my right hand, some of my right side, where my tremors were, and they would shake so bad I couldn't even really do too much of anything with it. I work with a lot of power tools and saws and things of that nature. It's a hobby, so it's very important to me to make sure I took care of the tremors. The process was very personal. The UNC staff made me feel like I was a person, not a number. It made me and my whole family feel very comfortable with what they were doing. And the doctors, they were fantastic. I can't say anything any better than it was just fantastic. The UNC staff made us all feel comfortable from the day one when we first stepped into the council until the day the procedure was taken care of. So we actually talked to them like they were relatives.
One of the things that's really important in nursing, because we give such hands-on care, is quality of life. And that's something that we find that we always come back to talking about with our patients. That's especially true in movement disorders, where when you have a movement disorder and these tremors that maybe impose on your quality of life, you can't even drink a cup without shaking it and spilling it on yourself, or you can't eat without your food falling off your fork, or you can't even wipe a tear from the cheek without fear of poking yourself. This is where the focused ultrasound treatment comes into play, because it can help restore this quality of life that we're needing for our patients. Having this treatment available here in the center of the state at UNC is very beneficial. We get people from all over the state seeking treatment and getting access to these advanced therapies that are really important.
Well, it's important it's close to home because you have a major hospital. When we have top-of-the-line doctors, you can't ask for any better than that. It's close to home. There are other people I know that have Parkinson's. Of course, it doesn't cure the Parkinson's, but as far as the tremors, I have nothing to say. My hand's not trembling. I have no tremors in it whatsoever. Thank God for that.
What's unique about the focused ultrasound program at UNC is we really truly utilize an interdisciplinary approach. And that's us, all of the professionals, sitting down and making sure that we're doing the right thing for our patient and discussing the case.
Of course, I did the background research on focused ultrasound, and UNC came up and talked about Dr. Roque and Dr. Krishna. Fantastic. So that put me in the ballpark of where I needed to be. They were close to home, and it made me feel like I was at home when I went to see them and talk to them. So that's why I chose them.
How the focused ultrasound differs from other treatment for movement disorders and tremor in particular is where with medications, I have no one medication I can give someone and say, for sure, I'm going to have a reduction in tremor with this medication. With focused ultrasound, I'm able to go in saying, we will have a reduction in tremor with this treatment.
But as far as I'm concerned, it's been nothing better. My quality of life has changed drastically.